Hello and welcome to Public Health Network Cymru's podcast. I'm Helen Green.
And I'm Sarah Nanwa.
In today's episode, we'll be putting a spotlight on the work of the British Heart Foundation, exploring some common misconceptions about heart health.
NHS figures show that coronary heart disease is the single largest cause of death in Wales, accounting for over 6,000 deaths per year. In the UK as a whole, there are approximately 270,000 heart attacks every year.
We went to the British Heart Foundation offices to find out more about their work. Good morning, we're here at the British Heart Foundation office in Cathedral Road, and I'm here with Ruth Coombs, who's going to talk to us about the work done here. So Ruth, could you give us an introduction to your role, please?
Yes, hello. I'm the head of British Heart Foundation BHF Cymru. My role is around the strategic coordination of all our activity in Wales, whether that's our policy and public affairs work, external engagement, stakeholder relationships, working with health service engagement colleagues to support the NHS and service improvement, and also supporting our fundraising team. And of course, obviously, we're very involved in research, and our research findings are being translated into improvements for people with heart conditions. But heart health is a really big issue for Wales, and something that I think people perhaps underestimate.
And what do you find are some of the biggest misconceptions in this area?
Well, certainly people seem to think that heart health is no longer a big issue, that as long as you look after yourself and you exercise, you don't smoke, you don't eat the wrong foods, you'll be fine. And certainly we know from evidence from research that yes, these things are contributing to risk factors for heart and circulatory disease, but we've still got 375,000 people living with heart and circulatory disease in Wales, and coronary heart disease is still Wales's single biggest killer.
And how do you think some of these myths or misconceptions have come about?
Well, I think because quite rightly there's been an emphasis on prevention and what you can do to support your health and reduce your risk factors. But people seem to have then leapt to the misconception that it reduces your risk factors to zero. And there are some things that actually you can't control. You can't control your age, you can't control your gender, you can't control your ethnicity. And we know that certain ethnic groups have got higher risks for heart disease. For example, people from a South Asian ethnicity are more likely and have a higher risk of heart and circulatory disease than other people. And that's something that you actually can't control.
And what impact does this misconception have on those people who are affected?
Well, certainly people with heart and circulatory disease, they sometimes tell us that they feel like people think that maybe they've contributed to it in some way, it's their own fault. It doesn't perhaps draw the same level of empathy, understanding and a sympathetic attitude as perhaps some other long-term conditions. And for all the people that are living with heart and circulatory diseases, they need support. They need support of practitioners, they need support of their family and friends and community, and a bit of understanding. One of the things that we sometimes ask people to do is to think about how out of breath you feel going up the stairs. If you're running up the stairs two at a time and talking on a phone, you might feel a bit breathless if you're quite fit. But somebody who's living with heart failure feels like that when they're walking on the flat, for example. So they need that understanding that just because somebody is walking and walking around doesn't mean to say that they're not experiencing symptoms, discomfort, and that their condition isn't impacting on their daily lives, because it really does.
And what do you think can be done to help address some of these issues and to make improvements going forwards?
Well, I think that heart and circulatory disease must still be a priority. It must be retained as a priority, and indeed it must be given more importance as a priority in terms of long-term conditions, so that practitioners are supported and enabled to help people with heart problems. We'd like to see a much more integrated service for people with heart and circulatory disease, so that their primary care workers and their secondary care support teams actually interact more, talk together more. So that's within health, and also a better join up between health and social care, because it's not just an illness or a condition that affects you physically in your health, it affects your way of life. So there needs to be much more engagement between health and social care, so that people can get a holistic package to enable them to live a longer and healthier and happier life.
If there are practitioners listening who would like to support people, are there any resources that you could signpost people to?
Certainly, bhf.org.uk is a fantastic website. We've got loads of information on there, information about our research and how that's improving people's lives, lots of information for practitioners. There is a good resource, for example, for young people, teenagers who've got heart conditions, because an average of 16 babies a month are born with a heart condition in Wales. And there's a lot of resource there that practitioners can signpost young people to for peer support, because we think that's also really important. So have a look at our website. There are videos on there. There's information in all sorts of different formats, and also statistics about how it impacts on people in Wales, and those are updated regularly, and you'll find it all on our website.
Brilliant. I really like the analogy you used of running up the stairs, and using that as a way to help people to empathise with what it's like living daily with a heart condition or heart failure.
Yeah.
Fantastic.
If you'd like to be involved with future episodes of this podcast, please get in touch by emailing publichealth.network@wales.nhs.uk or tweeting us at PH Network Cymru.